Patients have defended their local hospital after a consultant compared conditions there to the third world. A&E consultant Richard Fawcett apologized for the situation at Royal Stoke University Hospital, where patients faced long waits for treatment as staff struggled to cope with demand. He said frail and elderly people were being forced to wait in corridors for hours and hours due to overcrowding, with one patient claiming to have spent 18 hours on a trolley waiting for a bed. Mr. Fawcett tweeted on Tuesday, "I personally apologize to the people of Stoke for the third world conditions of the department due to overcrowding. Yesterday, patients in Stoke were still facing long delays, with reports some people were even sleeping on the floor. But they said it was wrong to suggest conditions there were on a par with the third world." One patient, a middle-aged woman who did not want to be named, said, "I'm not going to lie, I've been here over 2 hours, but they're busy." But to suggest it's like living in the middle of nowhere is ridiculous. I think the government need to do more, but the NHS is still something to be proud of. Information screens at the Stoke Hospital told patients that they faced a waiting time in excess of 4 hours. Non-emergency patients said they had been seen by the triage nurses after just over an hour. Carl Foster, from Stoke, said on Facebook, "People need to re-evaluate the use of the words third world. The fact that the hospital exists in the first place means that it isn't third world." People really need to get some perspective and stop being so melodramatic. A state-of-the-art hospital would not exist in a third world country. So not third world-like conditions either. The Royal Stoke Hospital is a far cry from images of third world clinics conjured up by Mr. Fawcett's tweets. It was formerly the University Hospital of North Staffordshire, but was rebranded when the troubled Mid Staffordshire Foundation Trust was dissolved following the scandal of high deaths and neglect at Stafford Hospital. It is now run by University Hospitals of North Midlands NHS Trust. It was rebuilt between 2009 and 2015 at a cost of £370 million following a private finance initiative, making it one of the most expensive hospitals in the country. In August 2015, the Trust launched the new Rapid Access Royal Stoke MS Centre for multiple sclerosis patients. The Centre of Excellence now cares for 2,500 patients. In January 2016, a new £1.5 million unit for patients with eye problems opened. And in September, health chiefs announced that 45 extra beds were to be created at the hospital as part of a £2 million investment to speed up A&E waiting times for thousands of patients. The hospital, which has an annual budget of £750 million, employs more than 6,000 staff. Just 3 days ago, hospital bosses announced they were setting up free yoga and Pilates classes for stressed out NHS workers to stop them going off sick. By contrast, the Kamuzu Central Hospital in Malawi in southern Africa has just 59 doctors and 286 nursing staff, serving a population of 4 million. Overcrowding is constantly a problem, and on Christmas Day 4 children died when a power cut stopped their oxygen ventilators working. The hospital, in Malawi's capital Lilongwe, is considered one of the country's best. But Malawi is experiencing countrywide critical power outages as the utility provider Electricity Supply Corporation of Malawi is failing to generate enough power to meet demand, the Nyasa Times reported. Dorothy Ngoma, executive director of Malawi's National Organization of Nurses and Midwives, said the healthcare system was in crisis and nurses were having to use torches and their mobile phones for light. "There's people's lives concerned here," she said. "We are witnessing the worst incident of a crumbling health service delivery system in recent times." Speaking on Times Radio, she added, "We have cases of premature babies dying in hospitals due to the absence of power for the incubators." The University Hospitals of North Midlands NHS Trust did not respond to request for comment.